Today marks 24 days since Uganda confirmed an Ebola outbreak in Mubende district. The outbreak that has claimed at least 19 lives is in 5 districts of Mubende, Chegegwa, Kasanda, Kagadi and Bunyangabo. Uganda is set to receive 471 doses of Ebola trial vaccines in the next 1 week to be administered in the affected districts. Another 40,000 to 70,000 doses are expected in November.
2 vaccines coming in, all for Sudan Ebola virus. One Oxford, manufactured in the United Kingdom, and the other Sabin, manufactured in the United States of America. Now, these vaccines have already undergone research for efficacy and safety. We are continuing with research because we want to understand how long they protect. That is a question that must be answered. And every opportunity we get, we need to harness it.
However, the Health Ministry says there is need to strengthen community mobilization and engagement to effectively prevent the further spread of Ebola. Health officials from 11 African countries and the World Health Organization, African Center for Disease Control and Prevention, among other agencies, converged in Munyonyo, Kampala to discuss cross-border collaboration for preparedness and response to Ebola virus disease. Africa CDC has challenged countries on the continent to wake up and face the reality that they're on their own and need to invest in research and development for sustainable disease management.
And the reality for us is that when a public health crisis is big, like the pandemic, Africa is on its own. When an outbreak is much smaller and only affects African countries, like Ebola, like Lassa fever, like monkeypox, Africa is still on its own.
In this regard, we asked the Ministry of Science and Technology on how far Uganda had gone with manufacturing of our own vaccine.
No, that's the challenge. You think that when I start working on a vaccine, it is coming out tomorrow. The vaccine is being worked on, but it is still in the process. We are now preparing what we call a pilot plant to produce doses for clinical trials.
Meanwhile, there are concerns that the Ebola virus could spread to the neighboring countries.
We don't intend to put any restrictions in place because the restrictions are not going to work because the formal border points are few. Yet the entire border stretch between us and Uganda is very, very long, and you cannot, for all practical purposes, you cannot be able to put officers to be able to screen people through the porous borders. It is safer for people to come through the formal borders.
African countries have resolved that there is need for robust joint monitoring and a sub-regional approach to prepare and effectively respond to Ebola virus disease and other similar outbreaks, as well as sharing information and resources, among others.
We want to build on the existing integrated disease surveillance and response systems. We are looking at and recommend that you train a pool of contact tracers.
We have released $5 million for this response. It includes from the contingency fund for emergencies with the support from donors and partners. This funding is going to support Uganda. Part of it has already been released. 2 million is allocated to Uganda.
There is an urgent need to save lives by enhancing preparedness at border crossings and within their respective national boundaries. Norbert Atkunda, NTV News.